Good evening, you're watching a special edition of The Big Story. I'm Haryanto Diman coming to you live from the Straits Times newsroom. News just in, Singapore plans to double the bed capacity to 20,000 in community care facilities meant for patients with mild symptoms by end of June. Recovery facilities for patients who do not need further medical care will also be expanded to about 10,000 beds by end June. With the surge in patient numbers due to COVID-19, these facilities ensure that the beds in hospitals remain reserved for those who need them the most.
Studies have shown that patients who remain well at day 14 of illness are likely to remain clinically stable and generally do not require any further medical care. They no longer need to remain in the CCF or community care facilities. These patients may be transferred to a community recovery facility or CRF, which does not need to have medical services.
Screening for nursing homes will also be stepped up, said the task force.
And the numbers are what they are, but the numbers that we see every day are sometimes also a result of the extensive testing that we do. And we are ramping up testing. We have been doing this extensively. We've reported this, or we highlighted this yesterday, and we said that we are also going to be doing more testing, particularly in vulnerable areas across our nursing homes. For example, the residents, the staff of these nursing homes. As we do these active testing and sweeping of cases, I would not be surprised if we find more cases. These are what they call cryptic or hidden cases, because these are people with very mild symptoms, maybe even no symptoms at all, but they are in the community.
More manpower is also needed to support the expanded healthcare facilities. Since the launch of the SG Healthcare Corps on April 7th, over 3,000 professionals have signed up. The Healthcare Corps initiative calls for former and current healthcare professionals to be on standby.
Moving forward, Ministry of Health will expand SG Healthcare Corps to include more healthcare professionals as well as non-healthcare professionals. We are also redeploying manpower from industries affected by COVID-19 to enable them to take on new roles at our hospitals, such as our collaboration with the Singapore Airlines. We have been able to mobilize and ramp up our medical facilities and support in a short time because of the whole of society approach. It is this spirit of unity and resilience in the face of adversity that will see Singapore emerge stronger from this crisis.
For more on the COVID-19 updates in Singapore, do log on to straitstimes.com. For the full press conference, you can watch it on the Straits Times YouTube channel. Once again, I'm Haryanto Diman. Stay safe and have a good evening.